Well, President Akufo-Addo announced a ban on post-funeral and wedding receptions as part of a wide-ranging action to step tide in Ghana's third wave of COVID-19. He's also asked businesses to reintroduce the shift system and asked persons who can work from home to do so. Immediate timelines were not mentioned as to how these protocols are to be rolled out. Thankfully, we are joined by Dr. Aboagye Da Costa. He's Director of Health Promotion at the Ghana Health Service and team lead at the Risk Communication Subcommittee of COVID-19 Task Force. I'm grateful, Dr. Da Costa, for your time this afternoon.
Thank you, Aisha.
Doc, what differently do you seek to do, especially now that we all agree that people are not masking up, the same thing that will protect all of us from contracting the COVID-19 virus?
Thank you, Aisha. I think I heard the Director General on your, yesterday evening, outlining some of the things that has actually been put in place, especially for the places that we are recording cases like schools and other areas. Now, if you listen to Dr. Tinkrine he also said specifically that certain settings should actually make sure that they comply with the protocols, and he tasked the school heads to make sure that they supervise those activities. So we are now doing targeting, but the fact of the matter is that as Ghanaians, we must know that for us to obviously get the zero infections that we want, or for the general behavior change, the components are three. The education bit, which the Ghana Health Service we can do. We have been doing since this pandemic actually started. Then there is also the responsibility bit. And that is where we are having the challenge. The individual responsibility is key to behavior change. Then the third one is the enforcement. This is where we will be linking up again with the security services to support us, to help us in enforcing the targeted, areas that we want to, like you heard the president say that the various transport authorities should make sure that they enforce the safety protocols when people are coming to obviously board the transport. So in this case, we will engage the GPRTU, the other unions, which we have been doing. In fact, we've offered a couple of trainings for their leadership for the schools. Yes, we use our school health education program with the Ghana Education Service to make sure that we reach out to them and educate the teachers again to make sure that they also enforce the safety protocols. So if you combine the three components, like the education, the responsibility, and the enforcement, we should actually get people obviously complying. So the media, to be honest with you, play a key role. Now, we consider you as frontline workers. That is why we gave you some of the vaccinations. But now I know that, obviously, a majority of the stations have also relaxed the education. But the point is, it's a collective responsibility. So we are calling on you. My team, we've been going from community to community. In the Ghana Health Service, all programs that we do, we make sure that we add the COVID-19 education to this. So I think it's a continuous process. And I also agree that people are tired, but the virus is not tired of us. That's the challenge. The virus is not tired with us. And now we have a new strain, and this strain is said to be obviously more transmissible. So I think it is all hands on deck now for us to make sure that we achieve the ultimate aim of zero infection. Yes, authorities are doing their best to see how best we get the vaccines for the population, but we all know the challenges. So without the vaccines, previously, we managed to bring the infections down to about 300 in August 2020. So we can still do it. So let's all make sure that the momentum is back for us to comply with the safety protocols. It is difficult, but that is the solution we have now. We have no solutions than to tell Ghanaians to comply with the safety protocols, because at the end of the day, that is what we need. The only medicine for this COVID-19 fight is the safety protocols. Wearing your face mask, washing your hands with soap and running water, boosting your immune system with some of our local foods and products, fruits and oranges, pineapple and all the others, and making sure that we avoid crowded places. And when we are going to these crowded places, we have to obviously comply with the social distancing rules.
Dr. Da Costa, I'm happy you talk about crowded places, and I'm happy you talk about adhering to the protocols in our schools, because the Ashanti region health officials there are beginning to complain and have concerns about the number of cases we are picking up in our schools. In Accra, we've seen same. Achimota is one of the schools where many of the students contracted the virus and what have you. The point is, what is your plan for our schools? Are we going to see closure of schools again? Is it also part of your plans for our schools?
Okay, thank you. I don't think we should close schools. You see, if we manage the school setting well, it will be the safest. Because obviously you see the same people in the same area, confined places and others. You remember that previously I've said that the school was the safest place to be, especially where you remember the Accra Heights incident. And it is true, we only have to manage it. And you know what, the fact is, we have a very strong school education system. I mean, where we have what we call the SHEP, and they link up with the Ghana Health Service in promotion and other activities like nutrition and all the others. So we have activated that and we are using that. Now we are also organizing capacity building, obvious training for the school heads, the teachers, the other support services staff within the various institutions. And with that, we should be able to manage what is happening. But the general point I want to make is that it is not only the schools. Across board, we should see how every Ghanaian come on board to comply with the safety protocols. Ghana's COVID-19 management has been proper management, and it has been with the citizens. So the fact is, we need the citizens again, because without the citizens, obviously we cannot do anything. So we need the citizens to be along with us. We certainly need everyone to from now begin to comply with the safety protocols. Like I said, I appreciate the feelings, because it is difficult to wear them as people are tired, but the virus is never tired of us. So that is what we have to, and we all have to come together to obviously mount a campaign, not only the campaign on the education, but to assume that responsibility, the individual and collective responsibility, as we task our security agencies to also help us enforce the laws. And when we do these three, we will be able to achieve whatever that we want to achieve in reducing the infections.
Shortly before we spoke with you, we listened to some people we spoke to on the streets of Accra, and most of them lament over policemen who themselves are supposed to ensure that the protocols are adhered to, they themselves not adhering to the protocols. What's the collaboration between the Ghana Health Service and the law enforcement agencies in trying to achieve this kind of target we have?
Thank you. So we have a very good relationship with the Ghana Police Service. In fact, in the risk communication team, we have some of them on board. I mean, from yesterday's announcement, we will deepen the collaboration and make sure that we obviously engage further to see how best strategically. In fact, it came to a point that the police officers themselves were in the various communities educating the population. And I remember there was an intervention that they did, I mean, during the peak of the second wave, where when they will mount, I mean, they will be at various points, and when they see trotro and the other vehicles going and they see that you are not obviously wearing the face mask, they'll pull you down and either give you one or ask you to buy. So I think those interventions will be enhanced. I'll have a discussion with the police service to see how best we can further deepen the collaboration for us to achieve what we want.
So for this weekend, if I have a funeral, if I have a wedding, and just after these events, we try and do our after party, who is going to come after me? Are there people dispatched to do this? Just like we saw during the first wave, when all the security agencies were so serious about going about and arresting people. Are we going to see same spirit?
Okay, thank you so much. You know that we we have the district public health management systems linking up to the local authorities. You see, when you want to organize a funeral, certainly I think you need permission from the local authorities. So we are liaising with the local authorities to see how best we do this very well. Now, the fact of the matter is that the enforcement is with the local authorities. And the House will work with them to see how best we obviously implement what the president actually said. Now, the president said some very important actions that I think I have to stress. The church service and the burial service, those ones are already in place, and we are saying that that should be 2 hours. So that is it. Now, you know the one that we call a year, as you know, the one that we do in the afternoon, we are saying that comply with the safety protocols with social distancing. It should not last more than 2 hours. Now, we have come to the understanding that funerals are part of our culture. And even with the restrictions, funerals were banned, but we saw across the country that people were doing it, and we had to take action. So the president took action by saying that 2 hours with social distancing is allowed. So that is what, and if we are doing the 1 week as well, it's limited to family with 2 hours. So that is key. But the safety protocols should be in place, and the onus is on the organizers of those activities, because they will be held responsible should they not comply with those directives from the president. And like I'm saying, we'll be working with the local assemblies to make sure that these are enforced with the security agencies as well. So that's the clarity I wanted to bring to this discussion.
Now, we're told some few weeks back that testing is zero. That's what we're made to understand, that we're not doing the random testing that we started some time back. But we're also told by health authorities like yourself that it's only through testing that we can get to know people who have contracted, and then we do contact tracing and ask those people to isolate or quarantine and what have you. So where do we stand now if we've stopped testing?
Thank you. I don't think that we have stopped testing or we stopped testing. The fact of the matter is that, if you heard the Director General from the press conference, for the Minister's press conference, he actually stated that we're going to obviously test. But the point is, testing is actually determined by your cases and others. And now we are also going to make sure we enhance our 3T approach. That is the tracing, the testing, and the treatment. And you heard the president say that yesterday. So I know the case management team and the surveillance teams are on that, and they are having a series of meetings to see how best they strengthen. They'll be linking with the various regional directors across the country to see how best they strengthen the tracing mechanism. So I think that is it. But I can tell you that, obviously testing has never stopped. It's just that the fewer cases you get, then you see that the testing goes down. But we have never stopped testing since we obviously started this pandemic. Okay. That is why we are able to report the figures.
Doc, there's this particular one, and let me bring you in on this one. There's a professor who wrote an article this week talking about his experience at the airport when his wife was tested positive to COVID-19, and they were asked to go home and quarantine. Nobody gave them guidelines. Nobody told them, as you go, don't do this. And nobody followed up on that one. So if they just go out there and start going about their normal duties, because if they were asymptomatic, they could just be going about their normal duties, infecting other people. His complaint is that nobody followed up from Ghana Health Service. Nobody called to check on them, to ask them, nothing. I mean, what's your plan? If people test positive at the airport, what's the procedure?
Okay, thank you. So it's a good opportunity for me to explain what we do at the airport and when you test positive and also negative. So in fact, I have also seen a circulating video where a lady is claiming that she has done a lateral home test and others. So let me take my time to explain to Ghanaians what we do at the airport. So we are saying that before you enter our shores or before you board a plane outside to our country, you should have a 72 hours negative PCR test results, and it should be within 72. We are saying that when you when you land at Kotoka International Airport, we will also subject you to an immunofluorescent antigen test, which normally picks the live virus. So when we do that, number one, you are supposed to be given your results. If you are positive, then the Ghana Health Service team, including a counselor, will attend to you, take you through the processes. Now, there is also, government has dedicated a facility at Oyarifa for people who are not able to afford alternative accommodation like hotels, that selective hotels have been done so that, those hotels, I think we also have security personnel manning those hotels. So you have your choice of obviously taking the government facility or the alternative hotels that have actually been earmarked for this exercise. And these hotels are being manned by security officers. I think it's a range. So it is your choice to determine where you want to go. If you want to go to the government facility, we will take you to the government facility and treat you very well at the facility there. If you choose to go to any of the selected hotels, that is at your cost. And when you go there, whether government facility or at the hotels, the third day, we know that at the third day, we will come in and do another test for you, which is the PCR test. When your PCR test results is in and you are negative, then we will allow you to go. But if you are positive, we will keep you to make sure that the virus is not in you again. So that is the protocols. That is simple. Look, I am in the UK. Let me explain to you the UK protocols. See, before you come to the UK, you have to pay between £85 to £240 for a day 2 and day 8 test. Now, the UK public health system will not accept any test except the day 2 and the day 8 test. If you want to be released early, there is what we call test release. On the 5th day, you pay additional £90 for the test release. And that is what we are doing. So theirs is 5 days, ours is 3 days. And for theirs, it's either you are negative or positive. But for ours, you only have to be positive to do that. Now, if you are coming from a red zone country, you have to pay between £1,500 and £3,000. for your hotel, a pre-booked hotel, before they allow you entry into the country. So I think for Ghana, we have been very charitable to our brothers and sisters living abroad, and they should support us in obviously protecting the image of the country by doing the right things. Yes, we want them to complain when it is not right, and we will address the complaints. But what we don't want is for them to propagate falsehood. I mean, sitting on live, this thing, and tarnishing the country as if you have there are complaint procedures. And when you test positive, trust me, the Ghana Health Service will take you through the processes which you have to complain, and we will address them. There is no point, obviously, doing live, this separating video as if, because the test that the lady was showing, you can see that completely she does not actually understand what we are actually doing. And that is not right, because it is one country that we have, and we have to protect the image of Ghana.
But Doc, doesn't that come back to the issue of education? If you educate people enough on the processes that we have to go through, we won't go speculating.
Look, you see, before you travel, you get all the education that you need. Trust me, all those those who test positive, like I'm saying, we take them through a comprehensive education before we even take them to the various facilities that they have to, explaining the processes to them. All the airlines, we have organized training and so many things for them, so they know. But the fact is, what I'm saying is that, yes, we respect the feedback, but we are not saying that use the feedback to insult people. Use the feedback or use other medium to tarnish the country that you have. Because bear in mind, you see, once you do this, you will think that, okay, well, you are voicing your frustration as other things. Come to us, tell us. In fact, there is a line. Let me tell you something. The 121, the government information line actually gives you that opportunity for you to call.
Okay. But Doc, yes, are you also taking some of these feedbacks seriously?
Yes, let me tell you. You see, if you remember the last complaints that we had, it was out of those feedback that we brought the test to release, the 3 days test to release, because initially we were not doing the 3 days PCR test. We were not doing that. But when we heard those complaints, people feeding back to us, we said, okay, what are other countries doing? We can learn. So we did the 3 days test to release, even after positive. So I think that was a massive improvement. And since then, I have not heard anything until this lady obviously issued the video out, obviously alleging all sort of things. But I know the Director General met with her, and we take it serious, and we will make sure that we get to the bottom of it. But my only challenge is that, you see, we shouldn't really take the opportunity to tarnish a country that obviously others are praising. If you have a challenge, a complaint, get to us. We will address your complaints. I mean, it's also part of the system, and we are supposed to do that. Like I'm saying, the 321 line is available. Even the 121, the one that we've been using for COVID, that one too is there. So there are channels for complaints. We have not closed our doors. The airport company also do have channels for complaints. And I think when I was speaking to their director of communication, they have their numbers actually there, that when you have such challenges, you can always call them, and we are prepared to obviously address people's concerns. We are really prepared to address people's concerns, because it is really important that we serve our customers well, and in serving them and serving the Ghanaian population means that we have to hear them.
Dr. Abuajeda.